Hi everyone, my name is Kuratanan, a dental professional who recently cleared the ADC exam on my very first attempt. I know how overwhelming it can be to prepare while managing work and life, so I have started this channel to make it easier for you. Here, I'll be recording and sharing therapeutic guidelines in audio format so you can learn on the go, whether you are driving, cooking, commuting, or just relaxing. My goal is to help you revise smarter, stay consistent, and feel confident in your journey. Stay motivated, learn efficiently, and prepare with confidence. Subscribe and join me on this journey. Okay, so welcome to my channel. Let's start the first chapter of TG. Principle of Diagnosis and Management in Dental Practice. Overview of diagnosis and management. The information included in this topic is appropriate for dental practice and may not be applicable to other areas of medicine. The general principles of managing oral and dental conditions are summarized in box 1 below. Box 1. General principle of managing oral and dental conditions. Dot points. Number 1. Identify the disease and its cause. Establish a diagnosis. Then provide acute care. Address the cause to prevent recurrence. Address the effect of the disease. Then restore normal function. Monitor healing. And provide ongoing monitoring and management, particularly for chronic or recurrent diseases. So that was the box number 1. The process of establishing a diagnosis begins by taking a thorough history, then conducting a clinical examination, and performing diagnostic tests if appropriate. The clinician uses this information to establish a diagnosis based on a knowledge of oral and dental diseases and the systemic diseases that can manifest in the mouth. Clinical clinicians should also consider the possibility that the patient's symptoms may be an adverse effect of a drug. It is usually possible to establish a diagnosis for dental problems before starting treatment, unless emergency or acute treatment is required. If the diagnosis is unclear, the clinician should either defer treatment while awaiting further information, for example, any test result, or the clinician should refer the patient to a specialist. It is essential to identify the cause of the disease because addressing the cause is an integral part and usually the first stage of managing the disease. The cause may be simple, for example, dental caries as a cause for pulp disease, or it can be complex, for example, a systemic disease with oral manifestation. Now, complex conditions may require other management in addition to dental treatment and consultation with or referral to the patient's medical practitioner. Risk factor for the disease should also be identified and modified if possible as part of the overall management of the patient. If the cause is not addressed, rapid or full recovery may not be achievable, or an acute condition may progress to become chronic. Once the diagnosis and cause have been established, the clinician should decide an appropriate management strategy. Now, there is a distinction between management and treatment. So, treatment refers to a systemic course of medical or surgical care, whereas management encompasses the overall handling of the patient and their health issues in a sensitive manner in addition to treatment. Drug therapy or irreversible dental treatment should not be started until the diagnosis has been confirmed. The approach of let's try this and see if it helps or just in case is not recommended. It may expose the patient to incorrect or inappropriate treatment, or it can mask signs or symptoms that could indicate a particular diagnosis. Most conditions that lead patients to visit their dentist, they require dental or oral treatment. Drugs are usually only needed adjunctively with consideration of the likely benefit and potential adverse effects. Taking a history. When a patient attends a dental practice, establish the reason for their visit. Take a dental history, which includes an overview of the patient's previous dental problems and treatment, and a detailed history of the presenting condition. This assists with forming a provisional diagnosis. Several potential diagnoses, that is, differential diagnosis, may be likely. Ask specific questions to narrow the field. Open-ended questions are more effective than leading question. For example, ask the patient what particular things cause dental pain, rather than asking if hot or cold drinks cause pain. Then take a medical history, which includes age and weight, particularly for children, medical conditions, pregnancy and breastfeeding status, a comprehensive medication history, which includes prescription medication, over-the-counter and non-prescription medications, any complementary medicines if patient is taking, for example, vitamins, supplements, herbal medications, the smoking status of the patient, past and current birth, alcohol intake, use of illicit drugs, history of allergies and adverse reaction to drugs, and capacity assessment. Now here we need to assess the patient's overall capacity to provide an accurate history, if he can understand and consent to treatment, and understand and adhere to post-treatment care requirements. Consult the patient's carer, medical practitioner or GP, or other healthcare practitioner if needed to complete the history. If the patient is unsure of the medicines they are taking, ask them to obtain a current list from their medical practitioner, pharmacist, or electronic health record to bring to the next appointment. Always cross-check the medicine list with the medical history. There may be conditions the patient has forgotten to mention or has not disclosed. A complete history also includes the patient's social history, for example, family history, occupation of the patient, any recreation history. And at each appointment, check the patient's history for any changes. Now, examination and diagnostic tests. Before starting the clinical examination, a provisional diagnosis may be evident. Target the examination and diagnostic test to confirm the diagnosis and identify the tooth or tissues that are affected. Always choose tests that are evidence-based and will aid in decision making. Involve the patient in the decision to undergo a test. Diagnostic confirmation is particularly important if the dental treatment required for the provisional diagnosis is irreversible. For example, root canal, tooth extraction. However, the clinical benefit of performing a diagnostic test should outweigh any associated risks. Cumulative radiation exposure, particularly in childhood and adolescence, has been associated with an increased incidence of cancer. Aim to achieve the lowest possible radiation exposure while maximizing the diagnostic value of the test. The process of rational treatment. After taking a patient history and establishing a diagnosis, determine the therapeutic objective. for example, pain relief or treating infections, and then choose an appropriate treatment. Involve the patient in this decision. In dentistry, drugs are usually an adjunct to dental treatment. Starting treatment involves, I'm going to read those dot points, which are again very important. So, starting treatment involves providing the patient with information about the condition and the reason for treatment. So, you need to give information to the patient about what he's going through and why you are doing the treatment. Then, performing appropriate oral or dental treatment. If required, recommending appropriate drug therapy, writing an accurate prescription, and providing the patient with the required information. Then monitoring progress involves review the patient and deciding whether to stop, continue, or change the treatment. Okay. Now the role of drugs. What is the role of drugs? Overview of drugs used in dental practice. In dental practice, drugs are usually an adjunct to dental treatment. Appropriate dental treatment can minimize or avoid the need for drugs. For example, dental treatment of a localized and odontogenic infection usually avoids the need for antibiotics. The use of drugs can often be deferred until the response to dental treatment has been reviewed. If drugs are necessary, they are more likely to be effective if the cause of the disease has been addressed or dental treatment has been provided. Drug choice is based on efficacy, safety, suitability, for example, adherence issues of the patient comorbidities, drug formulation, and the cost of the drug. Inappropriate prescribing can lead to ineffective and unsafe treatment, exacerbate or prolong illness. It can distress or harm the patient. It can be costly. And for antimicrobials, it can contribute to antimicrobial resistance in the wider community. In Australia, medication-related problems cause approximately 250,000 hospital admissions annually and up to 400,000 presentations to emergency departments annually. This does not include adverse medication events for which the patient does not present to hospital. Many adverse medication events can be prevented by taking a detailed history and prescribing rationally. Patients often attend a dental appointment with an expectation of a particular treatment. For example, analgesics, antibiotics, which may have been influenced by advertising, unrealistic expectations, or maybe the patient is on drug dependent. So always consider alternatives to drug treatment and involve the patient in treatment decisions. Patients are more likely to choose conservative treatment strategies when a shared decision-making approach is adopted. Consider the likely benefits and potential harms of drug therapy. If drug therapy is appropriate, choose an evidence-based treatment for the condition with consideration of individual patient factors. Evaluate drug information to determine the therapeutic value. New and expensive drugs should be critically evaluated in comparison to established treatments. Off-label prescribing. Now, off-label use referred to use of a drug in a manner, for example, indication, dose, route of administration, patient group, which is not approved by TGA, which is Australian Therapeutic Good Administration. Listed products information. So off-label drugs, they are not approved by TGA. The manufacturer of the medicine, they do not carry any legal responsibility for off-label prescribing. Should an issue arise, such a serious adverse reaction, legal liability lies solely with the prescriber. Appropriate off-label prescribing requires sufficient evidence to support efficacy and safety, an overall favorable harm-benefit ratio, and the consent of the patient. Now, overprescribing and underprescribing. It is important that the dose, duration of treatment, and quantity of drugs prescribed are correct and they are clearly stated on the prescription. Overprescribing is wasteful. It can cause unnecessary side effects and increase the opportunity for overdose. Of particular concerns are drugs that cause dependence or are prone to abuse, for example, opioids or benzodiazepine, and drugs that have a narrow therapeutic index, that is, the therapeutic dose is very close to the toxic dose. Overprescribing of antimicrobials can lead to increased antimicrobial resistance. Underprescribing is also wasteful and potentially harmful, particularly because it can result in ineffective treatment. Now, sporting authorities and the use of drugs. Sporting authorities prohibit the use of some drugs by athletes competing in sporting events. Some of the drugs prohibited in sports may be prescribed or administered by dentists. Most elite athletes are aware of the requirement for their particular sports. Referral. So when you're referring a patient to another practitioner, for example, specialist, medical practitioner, a written referral should be provided. The referral should outline the presenting oral or dental complaint, suspected diagnosis if known, and relevant patient details. The referral should be recorded in the patient's history. The referring clinician should ensure the patient attends the appointment and communicate with the other clinician about the patient's condition. Likewise, if a medical practitioner has referred a patient to a dentist, the dentist should communicate with the medical practitioner. For example, need to provide feedback to the medical practitioner in writing form. Now, clinical records. Clinical records should be kept in accordance with the Dental Board of Australia guidelines on dental records. Dental treatment during pregnancy and breastfeeding. This paragraph is although very small, but each and every word of this paragraph is very, very important. So listen to it carefully. Most dental treatment can be carried out safely during pregnancy. So most dental treatment can be carried out safely during pregnancy. In general, elective dental treatment is best performed in the second trimester, that is the fourth, fifth, and sixth month of pregnancy. So we are talking here about elective dental treatment is best performed in second trimester. Elective procedure requiring general anesthesia or intravenous sedation, they should be deferred until after the birth and preferably until after breastfeeding has stopped. If the patient is unsure if she is pregnant, defer treatment decisions until pregnancy status is known. So here we are only talking about elective procedures, okay? If intraoral radiograph are necessary for assessment or diagnosis of infection or trauma, there is no reason on radiation protection grounds to defer them. So if the patient is going on through an infection or trauma while they are pregnant, we can safely take intraoral radiographs. They are saying in TG that there is no reason on radiation protection grounds to defer them. The Australian Radiation Protection and Nuclear Safety Agency, which we called our PENSA guidelines, they state that intraoral radiographs are not contraindicated during pregnancy. However, a leaded drape is recommended when the X-ray beam is directed downwards towards the patient's trunk. For example, when we are taking occlusal view of the maxilla. Okay. Now, for information on the use of drugs during pregnancy and breastfeeding, we will read in the later chapters. And here we have finished our first chapter. Hope you have enjoyed, and happy reading, happy studying. I will see you again with the second chapter of TG, which is dental prescription and prescription writing. Thank you. Bye bye.